they never thought it would happen to them. One small symptom ignored, one routine checkup missed. And suddenly, their life changed forever. Cancer doesn't knock before it enters. It comes silently, and sometimes too late. But what if just one video, one moment of awareness could save a life? Maybe yours, maybe someone you love. This is that moment. Don't scroll. Watch till the end, because this might be the most important 10 minutes of your life today. We're talking about a disease that is feared around the world, cancer. But have we ever asked ourselves, what exactly is cancer? What are its warning signs? Can it be prevented or treated if you or someone you know is worried about cancer? Watch this video until the end. It might save a life, maybe even yours. Cancer is a disease in which the cells in the body begin to grow uncontrollably. Instead of dying when they should, these cells keep dividing and can form a tumor, which can invade nearby tissues and organs. Cancer can occur in almost any part of the body, such as lungs, breast, liver, colon, intestines, brain, or even in the blood, known as leukemia. Common symptoms of cancer. Types of cancer. Cancers are classified based on the type of cell or tissue they originate from. The main categories include carcinoma, originates in epithelial cells, for example, skin or linings of organs. Examples: breast cancer, lung cancer, colorectal cancer, prostate cancer. Sarcoma arises in connective tissues, for example, bones, muscles, cartilage. Examples: osteosarcoma, bone cancer, liposarcoma, fat tissue cancer. Leukemia affects blood-forming cells in the bone marrow, leading to abnormal blood cells. Acute lymphoblastic leukemia, all chronic myeloid leukemia, CML. Lymphoma develops in the lymphatic system, for example, lymph nodes. Examples: Hodgkin lymphoma, non-Hodgkin lymphoma. Myeloma affects plasma cells in the bone marrow, for example, multiple myeloma. Brain and spinal cord tumors originate in the central nervous system, for example, glioblastoma, meningioma. Other rare cancers include cancers of endocrine glands, germ cells, or other specialized tissues. Causes and risk factors. Cancer is caused by genetic mutations that disrupt normal cell growth. These mutations can be triggered by various factors, including genetic factors, inherited mutations, for example, BRCA1, BRCA2 in breast ovarian cancer account for 5 to 10% of cases. Family history increases risk for certain cancers, for example, colorectal. Breast closing, parenthesis, environmental and lifestyle factors. Tobacco, leading cause of lung, mouth, and throat cancers, for example. Smoking causes approximately 85% of lung cancer cases. Diet and obesity. High fat, low fiber diets or obesity linked to colorectal, breast, and pancreatic cancers. Alcohol. Excessive consumption increases risk of liver, esophageal, and breast cancers. UV radiation, sun exposure, or tanning beds cause skin cancers, for example, melanoma. Infections. Viruses like HPV, cervical cancer, hepatitis B, C, liver cancer, or H. pylori, stomach cancer contribute significantly. Occupational and environmental exposures. Carcinogens like asbestos, mesothelioma, benzene, or radiation. Air pollution or chemical exposures, for example, pesticides. Age. Risk increases with age, as DNA damage accumulates over time. Other factors. Chronic inflammation, for example, ulcerative colitis increases colorectal cancer risk. Hormonal factors, for example, prolonged estrogen exposure in breast cancer. Symptoms of cancer. Symptoms vary depending on the type, location, and stage of cancer. Common signs include general symptoms, unexplained weight loss, fatigue, fever, or night sweats. Persistent pain. Specific symptoms, lumps or masses, for example. Breast or testicular cancer. Changes in skin, for example, new moles, sores that don't heal. Abnormal bleeding, for example, blood in stool, urine, or vaginal bleeding. persistent cough or hoarseness, lung or throat cancer, changes in bowel or bladder. Habits, colorectal or bladder cancer, difficulty swallowing or persistent indigestion, esophageal or stomach cancer. Note: early-stage cancers may be asymptomatic. Highlighting the importance of screening. Diagnosis: cancer diagnosis involves several steps to confirm the presence, type, and extent of cancer. Medical history and physical exam. Assess symptoms and risk factors. Imaging tests, X-rays, CT scans, MRI, PET scans, or ultrasounds to locate tumors. Biopsy. Removal of a tissue sample for microscopic examination to confirm cancer. Laboratory tests. Blood tests, for example, PSA for prostate cancer, CA2 125 for ovarian cancer. Tumor markers or genetic testing. Endoscopy, used for cancers of the digestive tract, lungs, or bladder. Staging determines cancer's extent, for example, stage I4, with IV being advanced with metastasis. Treatment: cancer treatment depends on the type, stage, and patient's overall health. Common approaches include surgery, removes tumors or affected tissues, for example, mastectomy for breast cancer, used for localized cancers. Radiation therapy uses high-energy rays to kill cancer cells or shrink tumors, often combined with surgery or chemotherapy. Chemotherapy uses drugs to kill rapidly dividing cancer cells. Effective for cancers like leukemia or metastatic disease, but causes side effects, for example, hair loss, nausea. Immunotherapy boosts the immune system to fight cancer, for example. Checkpoint inhibitors like pembrolizumab, effective for melanoma, lung cancer, and others. Targeted therapy targets specific molecules in cancer cells, for example, trastuzumab for HER2-positive breast cancer. Fewer side effects than chemotherapy. Hormone therapy blocks hormones that fuel certain cancers, for example, tamoxifen for estrogen-driven breast cancer. Stem cell or bone marrow transplant, used for leukemias or lymphomas after high-dose chemotherapy. Palliative care focuses on symptom relief and quality of life, especially in advanced stages. Prevention: while not all cancers are preventable, the following strategies can reduce risk. Lifestyle changes. Quit smoking and limit alcohol. Maintain a healthy weight through diet and exercise. Eat a diet rich in fruits, vegetables, and whole grains. Screening and early detection. Mammograms, breast cancer, colonoscopies, colorectal cancer. Pap smear, cervical cancer. PSA tests, prostate cancer. Regular skin checks for melanoma. Vaccinations. HPV vaccine prevents cervical, anal, and oropharyngeal cancers. Hepatitis B vaccine prevents liver cancer. Sun protection, use sunscreen. Wear protective clothing and avoid tanning beds. Avoid carcinogens, minimize exposure to asbestos, radiation, or chemicals. Epidemiology: global burden, according to the World Health Organization (WHO), cancer is a leading cause of death. With approximately 10 million deaths in 2020, common cancers include lung, breast, colorectal, prostate, and stomach cancers. Regional variations: incidence varies by region due to lifestyle, screening, and healthcare access. For example, lung cancer is prevalent in regions with high smoking rates. Survival rates vary by cancer type and stage. For example, 5-year survival for early-stage breast cancer is approximately 90%, but for advanced lung cancer, it's approximately 5 to 10%. Living with cancer: psychological impact. Diagnosis can lead to anxiety, depression, or fear. Support groups and counseling help. Follow-up care. Regular checkups to monitor recurrence or side effects of treatment. Survivorship. Focus on long-term health, managing side effects, and maintaining quality of life. Recent advances: precision medicine, tailoring treatment based on genetic profiling of tumors. CAR T-cell therapy, a type of immunotherapy showing promise for blood cancers. liquid biopsies, non-invasive test to detect cancer DNA in blood. I in cancer care. Artificial intelligence aids in early detection, diagnosis, and treatment planning.